We're delighted to be joined by Representative Mark Pocan, taking some time out for us this morning. Good morning, Representative. Thank you so much for being here. How you doing?
Hey, good morning. Thanks so much for having me. I am doing really well. Been home all week, which is a bonus.
Yeah, no kidding. We're going to get to town halls probably towards the end of our conversation because
Okay.
I'm just curious if you're going to be out hitting the road since Democrats seem to be willing to talk to people who vote.
Yeah.
The other side, not necessarily so much. We did want to start off, though, Representative, with this report that came out from Robert Kennedy Jr.'s Department of Health and Human Services, the MAHA report that came out yesterday, which it has been determined that a number of the studies cited in this report don't exist. Calvin, we still have that clip from White House Press Secretary Carolyn Leavitt explaining why that is. Let's play that clip for Representative Pocan, please.
We have complete confidence in Secretary Kennedy and his team at HHS. I understand there were some formatting issues with the MAHA report that are being addressed, and the report will be updated, but it does not negate the substance of the report, which, as you know, is one of the most transformative health reports that has ever been released by the federal government and is backed on good science that has never been recognized by the federal government.
Well, it's not recognized because those reports don't exist. I find that somewhat problematic. Do you?
Oh man. We had Secretary Kennedy in front of my subcommittee a few weeks ago, and you know, I was trying to be nice, and I asked him, I thought, some friendly, softballish questions that would provide people some reassurance around vaccines, and he took it in a very, very different direction. And throughout the hearing, listening to him, I mean, yeah, I think his idea of science and science's idea of science are maybe a little different. And
Yeah.
I think it's admirable that he wants to take out some of the dyes that are carcinogenic and other things. I think that's the right thing to do, and I give him credit. And told him that in the beginning of the questioning. But then, he takes it sometimes a step, or maybe a few running jaunts too far, and then goes into this junk science and stuff that really isn't verified. So the problem is, now that I'm back home, I'm talking to all kinds of people who work for the university, researchers and others, people who work with medical devices in the area, and everyone's just afraid because science is no longer respected in this administration, and it's really difficult for them to move forward with things like this report yesterday.
Well, and Representative Pocan, we actually have a clip of that, a brief portion of that clip. Calvin, can you play that? And I want to say something after that, but this is you speaking to Health and Human Service Secretary Robert F. Kennedy Jr.
Just because I think this is a helpful answer, and this isn't a gotcha, I promise. If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya
Sure. No,
to the
like I said, I don't want to.
so that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice
Right.
from me.
Right. No, I got that, and I'm not asking you to give them medical advice, but would you vaccinate your
and
child for
I
measles?
think if I answer
That's
that
all.
question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to
Okay,
make
but
up
that's
their
kind of
own.
your jurisdiction because CDC does give advice, right? I'm
Well,
not trying to
well,
do it as a gotcha. I was just
yeah.
It's your job.
Yeah. And I want to make something really clear. Is I pulled that section from a longer conversation.
Yeah.
There's no editing. It's
Yeah.
exactly how. But the thing is before and after, you comport yourself with the notion of, I'm not trying to trick you up. I'm not
I
trying
wasn't
to.
trying to.
Oh,
Yeah, and I wasn't trying to either. That's the thing.
yeah. And yet he just and we're seeing this with all sorts. I mean, whether it's Christy Noma, all sorts of individuals who just will never answer the questions that are real simple too.
Yeah. No, and it's secretary after secretary. I asked, the Secretary of Education some really simple questions as well about their agency, about the people they fired, and she didn't have answers. People, even the Secretary of Treasury, who's not a dumb person, Secretary Besant, uh, but plays a dumb person on TV for Donald Trump, who couldn't answer a simple question about who pays tariffs, right? And it got a lot of ahs, and then finally it's a complicated question. And at the end of the day, I mean, we all as consumers pay tariffs, because whoever's importing it is paying it, but they pass it on to us,
Right.
the consumers. But none of these people were selected for expertise. Remember that. The first time he did select people who at least were experts in areas, this time around, he selected people based on their Fox News video footage. You submitted your video footage to him and your loyalty to him. So, of course, that is great for authoritarians because that means, no one's going to question decisions you make. But it's a very, very different way of dealing with, the executive branch right now.
Well, and it's certainly previous people who have held cabinet positions are not necessarily experts on everything, but they have some experience with the issues that the agency that they're heading up are dealing with. And
Yeah.
that is not the case this time around. And in the lead up to the November election, we talked about Project 2025, which
Yeah.
stated very, very explicitly the whole goal of a second Trump administration was to surround him with people who answered to him and
Yes.
only him. That is their qualification, correct?
Yeah, I mean, this is not about any past presidency, Democrat or Republican, that we've had that I guess I would say is normal. This is about consolidating power to one person, not even one branch of government, to one person, Donald Trump. And unfortunately, Congress, a co-equal branch of government, is also acquiescing, ignoring Article 1 of the Constitution that gives us the power of the purse and other powers, including tariffs. And because of that, Donald Trump has the power of a king, he thinks, even though the rule of law disagrees with him. And the good news is, by the way, I do want to say this because this is positive. The rule of law largely is upheld. He's had over 100 adjudications against him, and he caves every time. He is the caver in chief. So he may try to do another lawsuit, but where we're winning on a regular basis, including by Trump appointed judges,
Yes.
is in the courts.
Yes. Well, and that's why he was freaking out on social media yesterday about not, the Supreme Court, the International Court that ruled against his tariffs, and of course to Donald Trump and all of his supporters, anyone who rules against him is an activist judge. They're
Yeah.
now everybody is an activist judge if they don't agree with Donald Trump.
Yeah, and they even try to sneak some language in about the courts and their big, beautiful bill for billionaires. And by doing that, I don't think that language, first of all, will hold through the Senate rules, much less senators go along with it. But there was an interesting exchange with a member from Nebraska who was asked about it, and he told in a town hall, he said, "Well, I didn't know that was in the bill, and you should have saw the response he got." Well,
Yep.
that's the problem when you write bills all night and you vote on them just as the sun is starting to come up. Maybe you got some problems in there. In fact, one problem, if I can, I know this is a quick aside, but there's a $500 billion cut to Medicare in the bill the House passed because it gets triggered by the sequestration rules for PAYGO. And they could have fixed it and they didn't because they didn't want to, they just wanted to get this thing done. So every Republican, Derek Van Orden, Brian Stile, all the rest from Wisconsin voted
Yes.
to cut $500 billion from our Medicare that we've paid into all our lives.
On that note, and this speaking of a side note, here's another side note. Joni Ernst from Iowa at
I
a
saw
town
that.
hall was asked about Medicaid and SNAP cuts. Some people in the crowd said people are going to die because of this, and her response was, "Well, we are all going to die."
Yes. It's a new strategy. I have not heard done in the past. But I did see that clip and I was astonished by it, which is probably why, Derek Van Orden's locked in the basement this week and not allowed to go out
Oh
because,
man.
people like him don't maybe have the cognitive ability to pivot on a question like that. And he might have had a similar answer. And that's why they're told don't have town halls.
Well, and Derek Van Orton has been adamant that there will be no cuts from SNAP. There will be no cuts from Medicaid. Democrats are lying to the American people, according to Derek Van Orton.
We're not lying. It's the Congressional Budget Office, which, by the way, everyone there has been appointed by Republicans, is the one who's giving us these numbers. And so, they can say what they want to, but 14 million people will lose health care. 11 million people will lose food assistance. Millions of people will pay more for health insurance because there's a provision, and we don't have the numbers on this, where they take away some of the subsidies for the Affordable Care Act, $300 billion worth. There was an example of a couple 60 years old making 85,000 in my district that their insurance would go up 227%, up a $16,000 increase under the provision that's in the House passed bill.
That seems unachievable.
Yes, and that's the problem, right? So much of the House bill is ridiculously over the top bad, and the Senate's original bill they're working on had 2% of the cuts of the House. Now we'll see what happens. Now, then again, we can't forget our Senator Ron Johnson, who doesn't
Yes.
have a problem with the severity of the cuts. He has the problem with the leniency of the cuts, and he wants deeper cuts
Yep.
than the House passed. So a half a trillion cut in Medicare, $1 trillion between Medicaid and ACA cuts isn't enough for Ron Johnson.
If you're just joining us, U.S. Representative Mark Pocan is our guest representing the 2nd Congressional District here in Wisconsin. We're talking about the budget bill. You did say something that I wanted to just take a moment to highlight. Mike Johnson, the Speaker of the House, Mike Johnson, said this week that everyone on the congressional budget, the CBO, is a Democrat. He said that this week, that every single person on the CBO is a Democrat, and therefore those numbers can't be trusted.
Yeah, they're all appointed. Everyone who's the head of the CBO has been appointed by Republicans. We haven't had a Democratic appointment in 10 years. So, he can say, they can lie all they want to, but, I have faith in the American people, and they're going to believe. To me, the single best way of proving our point isn't the he said, she said, arguing the numbers. If you were really proud of this, you would get on the rooftop with a megaphone and brag about it.
Mhm.
Go across your district and have town halls to let them know what you're doing for them. But when we get a chance to talk about the tax provisions, wait till I share some stuff there about this bill. I mean, this is a bill that only Elon Musk and Donald Trump could love, and that's why they're hiding in their basement. So hopefully Derek will be able to come out on Monday when he's got to fly back to Washington. But there's a good reason they're hiding.
Well, and that's why they're talking about it and voting at midnight and 2 o'clock in the morning. And they always say things like, do your research. Well, yeah, but you're on television doing this work. We know when, like, you could do it on a Tuesday at 12 noon. We'll still see what's happening. We're not seeing this happen.
Yeah.
And you're right. You want to be able to take something back to your constituents in your district and say, look what we're doing for you, but they're not, because they know these constituents are mad.
Yeah, we've passed 6 bills this Congress, 6, through the House, Senate, and signed into law. This is their holy grail, the tax cut. They've got a bunch of awful cuts, and that's why they're afraid to talk about it. But again, the smell test, the common sense test, is you would be bragging about it if it was good. The fact that you're not tells me everything. I don't need to know. For most people, they can tell who's authentic and not about this.
We're going to continue our conversation with Representative Mark Pocan on the other side. Stay with us. Joining us is I'm going to say Congressman, since representative is apparently too hard of a word for me. Congressman Mark Pocan is here, and we're talking about the budget and many other things going on in Washington. You had mentioned before the break, Congressman, that every Wisconsin Republican is all about this. Representative Brian Stiles says the House budget bill is unquestionably a step in the right direction.
Yeah, tell that to the 1.3 million people on Medicaid in Wisconsin that are going to maybe see their Medicaid taken away. The 1 out of 3 kids in the state that gets their health insurance from Medicaid. 55% of seniors in nursing homes get their support from Medicaid. 45% of adults with disabilities living independently get their support from Medicaid. So, if he thinks it's so good, I got the feeling there's a lot of people who may not agree with him right in southeastern Wisconsin.
Well, and we spoke to a gentleman who is on Medicaid who has some physical challenges. He is working, and he talked about what a long process it is, and they get checked up on with consistency. It's not like there's no oversight over people who are receiving Medicaid.
2/3 of the people are working poor. who are getting Medicaid. So they're already working, right? So this whole work requirement really is more of a paperwork requirement to make fewer people get their coverage. Arkansas did some of these changes, and when they
Yes.
did, it was found 70% of the people that lost their coverage were eligible, but simply couldn't go through all the compliance hoops that it would take to do it. So, that's Medicaid. Food assistance, not only did they severely cut it and hurt Wisconsin. Derek Van Orden made some stupid comment about he fixed something on it. Well, the fix was like how you fix a dog, because it's not working anymore with what they did. We're going to be now on hook. Administrative costs, 75% of them, not 50-50 split, but also minimum 5% of the cost of the food share program, the supplemental nutrition assistance program in Wisconsin is food share. But because we have one of the lowest error rates in the country, but because of whatever fix Derek did, we're probably now going to be online for 15% of the cost. So it's somewhere between 130 and 300 million a year additional cost to Wisconsin to pick this up. And if we don't, that means even more people will lose their food share. But one last thing about this, just it's so horrible about how they did this. Now up to 56 years old, after 56, you don't have to as regularly prove what you're doing to continue getting food assistance. They raised that to 64 because those spry 63 and 64-year-olds, but it used to be if you had a single parent and had a kids up to at 18, up to 18, you didn't have to do the compliance as often. Now
Yes.
up to 8.
Yep.
At 8 years old, when you're old enough to work at a mine, I guess, you now have to prove that you still need food assistance.
Well, and that brings up two things that this discussion brings up. One, if the money is going to be left to the state, good luck. Madison, that state
Yep.
house doesn't like to fund anything. Period. You're on your own. But also this whole thing of the working poor and the way that some congressmen and senators and just people who want this bill to go through frame it as able-bodied workers, which we don't talk about that, which is people who work a job whose job doesn't provide insurance, doesn't
Yeah.
provide enough insurance, or their job says, hey, go on your state's insurance because that's better. This is not people gaming the system. This is not fraud or abuse. This is about people who are not getting paid enough and people who don't have good health insurance. So
Yeah.
whenever they say able-bodied, I say, oh, so you're talking about a terrible workplace for them. But they're still doing it because they have to make money.
Yeah. And the tax provisions, the few tax provisions that help tipped employees or on overtime pay, etc., all of that adds up to 5% of the bill. The vast, vast majority goes to the very wealthiest in this country. So, this is a Elon Musk, Donald Trump, dream, and the rest of us get to pay for it.
It's literally scraps on the table. Like, here
It
are your
is.
scraps. We get the fancy dinner. You can have the leftovers, maybe.
Yeah.
Congressman Mark Pocan is our guest. We have just a couple of minutes left. Are you planning on going out on the road again, having a couple more town halls in some redder districts?
Yes. Well, I did one in my district in Dodgeville this week, but tomorrow at 10 a.m. in Eau Claire at the Pablo Center, Derek and I have been invited by Opportunity Wisconsin. So I'm really looking forward to debating Derek on this bill. My guess is it's more likely I will sprout a head full of hair than he will show up at this thing tomorrow. But if he shows up, I'm really looking forward to it. If not, at least people in Eau Claire can be heard. They can see why Derek is hiding in the basement, probably next to the bar, and we'll figure it all out from there. But this is important to let people know what's in this bill because there is a very good reason why Republicans are hiding from town halls.
And people are showing up at these town halls that you're hosting that are not just Democrats, correct?
Oh, absolutely. Everyone's invited, everyone. And, I'm glad to talk to anyone about the merits of this because this is a meritless bill. I mean, this is an awful bill on so many fronts. I mean, we didn't even mention the $330 billion cut to higher education, largely Pell Grants, including people who work and have Pell Grants. It used to be you could have 12 credits and work and still get a Pell Grant. Now they're going to take it up to 15, and that's going to hurt many local employers that we're already hearing from too. So it's full of bad ideas.
Congressman Mark Pocan from Wisconsin's 2nd Congressional District, thank you so very, very much.
you very
Always a
much.
pleasure to talk to you. Thank you.
Yeah, thank you as always. Have a great weekend.